Guys, this is a bonus video of hymology. I thought to myself, as long as I have an expert in penile injections here, might as well go over the training of how to inject the penis. And then for those of you who don't know me, I'm Shari James, RN. I help men avoid ED medications, get off of them, or in some cases, get them to work with my holistic approach to healing erectile dysfunction. All right, so I come into I'm a man, just for the sake of role play, I'm a man. I come into the office. I'm at, one of the last resorts, which is injections. So can you walk me through in real time, what it's like when you teach someone to give an injection?
Right. Well, Shari, of course, it's all by prescription. So the urologist usually will prescribe a certain ED injection based on the patient's experience or lack of results with the oral agents. So from there, we'll essentially ease them and make them more comfortable with injecting in that particular sensitive area. As as you can imagine, it's quite traumatic or possibly traumatic for a man. We'll emphasize that it's not to be used in combination with oral agents because they could run into problems with an erection lasting too long, which we'll talk about a little bit later. At that point there, we'll also remind them that this is all about the quality of their circulation. So our overarching reminder is to go low, go slow. So we don't want them jumping ahead as far as how much they use. We want to start off at very low to see what kind of response they get, and they will slowly move up scale. So typically they would use a diabetic syringe that's calibrated in.
Can I even show?
Sure.
I want to show. It's been a while. I did do diabetic nursing and when I was at the hospital setting, so I know what this looks like, but I hope this camera, hang on here.
We talk about sterile techniques, so we want to be sure that we provide a sterile alcohol swab. We want to be sure the top of the vial is wiped in the injection site because we don't want to have an infection, okay? And then from there, typically our dosing would be to start at 0.2, which is over here, and or 20 units on an insulin syringe. A patient will get some type of response, but may not get a quality of erection they want for penetration. Okay. And then they will slowly move up to scale until they get the quality of erection they want. So that's the important thing. So the other thing that we want to be sure is I use this model here because we don't want them to hit any of the surface veins.
No.
Of course, it's not an artery, so it's not going to gush, but if they inadvertently hit one below the surface, they just put their finger on it for a minute and it will stop. And we want to be sure that, remind them not to put it about halfway up the shaft on either side, right or left. And again, not too close to the scrotal sac. So in this area here is essentially where the shot should be.
May I have the prop, please?
Okay.
I'm gonna put it on camera.
Yeah.
So in that area right there. Correct.
Right.
Okay.
Now,
but no veins. You can see the veins.
Yes, and stay away from the top and bottom of the shaft.
Oh, I see. So on the side.
On the sides, either side, if you're left-handed or right-handed.
Okay.
And not too far up.
No top, no bottom. For sure. Kind of here in the middle, exactly. On the side without veins.
Right.
Okay.
So, and as I mentioned, it's possible you might hit a vein below the surface. Nothing to be concerned about. Put your finger on it, and essentially it'll resolve very quickly. Again, what I need to have these individuals understand.
Wait. Like I want to do it. I want to actually do it.
Do what?
I want to inject it.
I don't think an injection.
I want to pretend inject it.
Oh, I see. Okay. Right.
This has to be real, guys. Okay. So how this is what is that?
It's 5 cc's.
Okay. Well, all right. So how deep do I go in?
Well, the needle needs to go in all the way.
All the way?
All the way. Correct.
Ooh, so it's going into the tissues. Okay.
Well,
so
we're hitting the spongy tissue. It has a fancy medical name, but essentially we want to hit that spongy tissue because that's.
So it goes in all the way.
Right. Exactly.
And then you'll hit the plunger.
Yeah. Exactly.
And then you
pull the needle out.
Yeah. Hold it. Okay.
That's it. So,
and are they given like a little sharps container to put their needles in, and where do they dispose of their needles?
We provide a sharps container, and then each waste disposal, which each waste disposable company has their own protocol on either a Sharps container, which is ideal, and or some type of a coffee can or something with a rigid side so that nobody else has gets pricked by the needle. The Sharp container is by far the most widely accepted one. So
the brand name of them.
yeah,
I remember when they
exactly,
came out.
yeah. And you can get those at any pharmacy, CVS, Walgreens, Amazon, of course. So at this point here, after the injection, you'll want to take a look at the watch to see how quickly it starts acting. Within 5 to 10 minutes, it's going to have its effect. So don't re-inject. I think that's important to know. Wait at least 24 hours before you follow the directions on the label of the prescription bag to move up 10 units. So we're moving up 10 increments at a time, 10 units at a time, but we're waiting at least 24 hours before we do that. So once again, I can't emphasize enough, you don't want to re-inject, that's for sure.
Okay.
Within that same session, okay? And then eventually a quality of erection will occur that will allow penetration. If that formula is not strong enough, based on the individual's circulatory health.
Start low and slow.
Go low and go slow.
Low and slow.
Yeah, absolutely, absolutely.
And then work your way up.
And right. So, and then I tell my patients if they do get up into the 70 or 80 range on insulin units or 0.7, to call me, because it may that some of the areas of failure is if the injection site was not done properly.
I could see, I mean, that goes in fairly deep, into a sensitive area. I can see where that would be a little scary.
And that's within one of the areas of failures. They just don't do it. So when I debrief them or ask them questions, if they haven't had any type of response, it just tells me that the technique is incorrect. I would bring them back in for retraining and point out the proper technique. Otherwise, it doesn't matter what formula you have, even if you went up to stronger formulas. If the technique's not proper, it's not going to have any effect at all. And then at that point there, the duration of how long it will last is also something we can debrief them on. And one of the other things is if there's vigorous sex involved and the circulation increases and it flushes the drug out of the shaft, so that they would say, Jerry, I got an erection, but it didn't last as long as I would like. And so if the proper technique is there and they've gotten the appropriate response, then we would use a restrictive device that's placed either behind the scrotal sac or at the base of the shaft. And what that allows is the drug to remain in the shaft longer, and therefore we're essentially restricting the drug from being flushed out of the shaft. So that is not for everyone. Sometimes it's dose related, other times it's formula related. But I ascertain that when I ask them questions on what exactly occurred. So, Jerry, I got an erection, enough for penetration, but it just didn't last long enough for that particular session. So from there, we have different tips and there are different kinds. There's the circular ones like this, and then there are some like a string tie from when we were younger.
Yeah,
so,
that's a good zip.
Because these have to be put on before the erection process occurs. Otherwise, there's just no way you're going to get those rings on. And the other ones are more of a string tie, and those can be put on even after the injection. So they're just different tips and tricks that I've found over the years that can address certain problems beyond changing the formula. So, and
I'm listening, and while we're talking, I think my cat wants to bring us a treat. What does she have for us? An owl. So she brought us a wise owl. So this might not be a wisdom bomb. Well, maybe it is a wisdom bomb. Okay, the cat has confirmed with the wise owl that this is a wisdom bomb.
Awesome.
So I have a question.
Sure.
Is the advice in the technique any different depending on if a man is circumcised versus uncircumcised?
No, because if you recall, the target area is the shaft, so it's nothing to do with whether they're circumcised or not. No.
Okay.
I have had some situations, very rare, that we actually would use an oral agent with the injections to start the erection process if the individual has a particularly small penis. And therefore, there's more surface area, if you will, to inject.
Sure.
But it's
Makes
very
sense.
rare, and I don't. It's not recommended that the combination be used. Just actually rare cases.
Okay. What is actually in the injection itself? Like what types of medications are being compounded?
Well, there's three main ingredients. One is called papaverine.
Okay.
The second one is phentolamine. And the third one is alprostadil or prostin. These are all vasodilating agents that were used 20, 30 years ago to reduce blood pressure by causing vasodilation in the extremities. And it's some smart doctor working with paraplegics that wanted to have penetrative sex thought that, erection is vasodilation, these are vasodilators. Let's just inject that into the penile shaft. And sure enough, paraplegics, as we know, have no nerve innervation from the waist down, and they got erections sufficient for penetrative sex. So I thought that was quite innovative, and it shows once again, with these injections, there's no need for a mind-body connection. So kiddingly, I say it's like a garage door opener. For the right dose, with the right formula, you will get an erection. And that's good, but also the danger, if you will, is priapism, which means an erection lasting too long. And I am more conservative than the drug companies. And I say after 2 hours, if you still have an erection, then you need to do something about that. And I have a rescue technique that I share, which involves understand conceptually that by increasing activity, brisk walking, perhaps up and down stairs, will increase your circulation and will flush the drug out of the shaft, thus reversing the erection. But if it does not, then you need to get to the ER, because priapism is a medical condition that can be quite dangerous going forward, and that needs to be reversed using another type of injection.
Oh boy. And then there's 2 other medications mixed in with the vasodilator.
Right. So we're talking about the injection itself, you mean?
Yeah.
Yeah. So there's we call it a single unit or single drug injection. Then there's the bimix, which has 2 of those drugs, and then once again the trimix, and those come in different combinations.
So they're all vasodilators, like different variations of. I didn't even know that. Okay.
Yeah, different types of vasodilators, and the effect, of course, is we're looking for vasodilation so that an erection occurs enough for penetration.
Okay, I see. Like, I just got wisdom bombed. I had no idea that I didn't know that. Okay.
They have different mechanisms of action as far as vasodilation.
Sure.
And that's what makes them so effective in combination. So the first one, or I should say the prostaglandin, oftentimes is used as the entry of the first ED injection, and for many minutes effective, for other minutes not. And then I usually recommend the bimix, which is the papaverine and the phentolamine, and then the trimix has that additional prostaglandin, and they all work a little bit differently as far as how they cause vasodilation, and in combination, they're more effective than either by themselves.
Okay, well, that was very enlightening. Thank you.
You're welcome.
Thank you so much. With regards to my holistic approach, I've often said, by the time you're getting injections, it's the equivalent of going to the emergency room and you're getting heart to penis resuscitation. So now I know what I was saying was more true than I even thought it was.
Yeah.
I mean, I thought it was true. Obviously, I know that it's true, but I feel like I have a deeper truth to that now. So this is why a holistic approach to healing ED is so important, even if you're already at the injection level, just really understanding the causations and then how you can be built up around the causations to get the injections to work. Hey, you. Hey, guy, who's learning about sexual health, mixed in with some Tantra, mixed in with some 5 elements of Chinese medicine and some Western medicine. I want to let you know something. I would love it if you would hit my subscribe button and the notification bell. That way, you're going to know when new content is posted every Friday.